every electorate I can only imagine, and Northern Territory and far north Queensland, and even over in WA over there. We love being with clients, we love helping people, and it's our ethos to get someone self-managing and independently engaging in the community, and that's what Pete was trying to share. He doesn't rely on exercise physiology anymore. He had a really big requirement to use us intensively at the start, and now he's got a gym program that he can regularly engage in.
So with my exercise physiologist support, thank you Gillian, I have managed emerging physical concerns, improved my overall health, maintained my independence and quality of life without needing to access aged care services.
This business is about people, and you can't run things on algorithms. You know, a computer can't do this. It's these people. So we have to have these people talking to us, and I thank you for it.
Thank you, Peter. I'm Katie Lyndon, CEO at Exercise and Sports Science Australia and a proud exercise physiologist. We are here today to launch ESSA's new report. We commissioned Deloitte Access Economics on valuing the contribution of exercise physiologists in Australia and economic perspective.
For a lot of Aussies, exercise is actually medicine. And that's really what we're here talking about today. Exercise and Sports Science Australia is launching a Deloitte Access Economics report showing that when exercise is correctly prescribed by qualified exercise physiologists, it can make a huge difference in people's lives. And I mean a real difference, not just to people's health, but to our health system and our economy as well. We need things that actually work, that improve people's health, and at the same time give taxpayers better value for money. And that's what this report is all about. Across 6 major areas, cardiovascular disease, pulmonary disease, conditions, musculoskeletal conditions, mental health, cancer-related conditions, and physical disability, the numbers are pretty hard to ignore. Over 3 years, exercise physiology is estimated to save $1.09 billion through the health system and productivity benefits. That is a bloody huge number, if I must say so. It includes around $940 million in health system savings alone.
Today, ESSA has proudly launched this report valuing the contribution of exercise physiologists and economic perspective right here in Parliament House. We are really fortunate to have a group of our exercise physiologists across the local community attend, along with their clients, to showcase the human story and the voice behind the power of these interventions. And grateful to have MP Dan Repacholi attend, as well as Senator David Pocock and our peers and friends across the health system, including Arthritis Australia, Dementia Australia, Pain Australia and the Lung Foundation. So we're feeling that support. We know that the evidence is strong and compelling, and the time to invest in exercise physiology is now. Exercise and Sports Science Australia commissioned this report from Deloitte Access Economics to show us the evidence, the economic evidence around the power of exercise physiology. We know the science around exercise prescription and programming for people with chronic disease from an exercise physiologist, and this report complements that by showing the economic and productivity gains by engaging an exercise physiologist across 6 different chronic conditions. It was important to us to complement this economic evidence with lived experience. So today we were fortunate to have several consumers come and share their personal story and journey in engaging an exercise physiologist and how that has transformed their lives. We also heard from several local exercise physiologists around their everyday work and the benefits that they realise for their clients.
And we're just seeing the economic benefit, the psychosocial benefit, the physical benefit, seeing people's quality of life change overnight, basically, as soon as they start to engage in some form of regular physical activity. And it's so important that we start to shift funds upstream, start funding preventable health and funding opportunity to start taking the burden off the acute system.
Hi, my name's Peter Lawson. I'm from Gordon in Canberra, and I'm connected to these physiology people through a virus that I got called Guillain-Barré syndrome, which put me in a wheelchair. So hence I had to go to a gymnasium, and the rest is ongoing. all the people that need the help of a physiologist, they certainly need help, and these people are just wonderful. Most elderly people have no idea about a gym. I've never been to a gym in my life till I was 74, and it has helped me so much. If I wasn't doing exercise, I doubt whether I'd be standing here, I'd be sitting in a wheelchair. And also, exercise will take a lot of the expense out of the health system, because people help themselves. They're not just going to the GP, with respect, who wouldn't know, what the internal things are wrong with you. So yeah, it's saving money, it's saving lives.
G'day all, I'm Dan Repacholi, a Federal Member for Hunter and also Australia's first Special Envoy for Men's Health. I'm also a 5-time Olympian and 3 times Commonwealth Games gold and bronze medalist, so I know how important exercise is and how important exercise is for people all around the country, and that's why I'm so proud that ESSA has done this report with Deloitte and got this out there, because there is some good cost-saving benefits in this report. So it's great that now you can actually put figures to what you have done in your industry for a long time, and we know people that are moving more are living longer and living healthier, so we need to make sure that we're looking after them and looking after the people that are helping them do that work.
We are grateful for Dan Repacholi's support. He has presented a great compelling case on the value of exercise physiology, and we are grateful for his leadership in championing the value of the profession.
But the other thing is good science. We're in the era of a lot of misinformation around. Cleanses, strange diets, weird exercise regimes. And what we need to cut through all of that is trusted expertise. And that's what exercise and sports scientists bring. You're looking at the latest journals, you're informed by your studies, you understand the research, and for people with scarce time, you know what advice to give them. You allow them to avoid the fads and focus on things that are going to make them healthier. We all enjoy living a healthier life, but also what you do is allow people to live longer lives, to have a few more Christmases with the family, to enjoy seeing their grandkids grow up. All of that is fundamental to a good life. Some of it is captured in numbers, like those in the Deloitte report you've got here, but much of it is just the intangible joy.
We were very fortunate to have Dr. Andrew Leigh, the Assistant Minister for Productivity, Competition, Charities and Treasury, join us today at our launch in Parliament House. This is important because ESSA's current campaign around removing GST from exercise physiology services is gaining momentum, and the evidence in this report presents a really compelling case on the economic benefit of investing in exercise physiology, with every $1 invested in exercise physiology achieving a $2.50 return. One key policy priority for ESSA at the moment, which we're using this report to help build the evidence base of, is removing GST from exercise physiology. We are the only Medicare recognised allied health profession that's not GST exempt, and we see that as a huge affordability and accessibility barrier for the 243,000 Australians that we see each week, because they're paying 10% more on the cost of an exercise physiology service for their chronic disease, and it just doesn't make sense.
I met Katie a couple of times now from ESSA, and she is doing an amazing job with her team. Well, they got this report out, and this is the first time they've been able to put numbers to what they're actually doing. So reports like this really do matter, because it gives us as politicians, and it gives everybody in there that is involved in ESSA a bit where they can talk about, where they can actually point to figures. And that is so important. I thank Katie and the ESSA team for being able to put this report together to be able to get the information out there to everyone. We need to keep this conversation going. We need all of you to keep this conversation going. So as Special Envoy for Men's Health, I look forward to continually working with ESSA to make sure we're investing in exercise physiology, backing the professionals who deliver it. So thank you to all the exercise physiologists out there. Make sure you keep that good work that you're doing out there and keeping Aussies healthier, Aussies alive longer and more active.